Okay, so maybe let's get started with a quick introduction. So my name is Alessandro Herman. I'm the head of the London office of Wonderwork, and I'm very excited to welcome all of you to today's second lunchtime talk, actually. Last time we had the Policy Lab here. They've been talking about some exciting cases around the topic of design for social innovation, and that's why we're here today again. With some new speakers, some very, very exciting guests, Lisa Moretti and Alfonso Montero. So really, really thank you for being here and joining our conversation about the challenges, but especially also the learnings of design for social innovation. So for those who don't know Wonderwork or who didn't have the time to join last time, we are a modern form of public sector consultancy, actually based in Vienna, but now also based in London. And our mission is to support the public sector in becoming more innovative, digital, and agile. And we focus also, obviously, a lot on design methods, also in policy context. So that's why maybe
Wonderwork som jobbar med att hur kan man göra offentlig sektor mer agile och...
Bra. Can you help us maybe with putting our guests on mute?
Yeah. I think you have to do it because you have a host.
Okay, so maybe can I ask everyone to mute themselves? I'll quickly do that myself, but I think it should be fine. Perfect. Okay, so great. So let's get going with our speakers today. Lisa Moretti, she's a digital sociologist at the UK Ministry of Justice. She has been researching a lot also on the relationship between technology, information, and society. She's been holding really great talks and speeches, also TED Talks, which I can really highly recommend to listen to. And excitingly, she's also been named as one of Britain's 100 people who are actually positively shaping the British digital industry in the category Champion for Change. And I think that's a really, really important topic. And I'm very excited to listen to Lisa to you today. And we also have Alfonso Montero here today. He's the CEO of the European Social Network, a community of more than 150, I think it is, organizations from across Europe, focusing on improving social policies and social services. And last but not least, Isabella, she is our social innovation expert. She worked also in an international setting with organizations like the United Nations, the UNDP, and UNICEF. So a warm welcome to all of you. And maybe Lisa, let's start with you.
Wonderful, thank you so much. I'm just going to share my screen. So if it's possible yes, thank you.
I think it should
that should be working.
Great.
Perfect. I'm just going to make this full size. Okay, can you see that?
Yes, we can.
Okay, perfect. I'm going to keep it in this mode because sometimes when I expand to full screen, everything crashes. So just for safety purposes, let's do it this way. Thank you so much for having me today. I'm going to talk to you for 10 minutes this morning on challenges with design thinking. And this is particularly a sociological critique because I'm a digital sociologist. So a little bit about me. I'm currently working at the Ministry of Justice as a digital sociologist on a service called Modernizing Lasting Powers of Attorney. The project is essentially looking to bring lasting powers of attorney into the 21st century. When people ask me, what is a digital sociologist? What is this role that you have? Essentially, my role is about working at the intersection of information, technology, social theory, and social life. Now, you can change information for content, or you could change technology for computing, but essentially, I'm working at those intersections, or at that intersection with those different disciplines and sectors. I also work as an associate lecturer at Goldsmiths at Cardiff and the University of Plymouth, where I teach design thinking and digital research methods. So talking to you about design thinking today is very much within my wheelhouse. Now, when I was approached by Wunderwerk to talk a little bit about the challenges of design thinking, the question that they asked me was, what are the challenges of a design thinking approach to social innovation? And so I'm going to kind of talk about this, like I said, from this more sociological perspective, the sociological critique of design thinking. So just a very quick overview, what is design thinking for those of you who might be quite new to this type of methodology? But essentially, design thinking is sometimes called human-centered design. It has its early origins in the 60s as kind of design science and the cooperative design movement that happened across Scandinavia. But it was really the creation of IDEO with the Kelly brothers in the 90s and in the US, really commercialized the approach and saw design thinking kind of really expand into a more corporate organizational setting. It is now even expanded further, and there's lots of governments, lots of social enterprises, lots of charities that now use design thinking. It's essentially both a kind of methodology, but also a creative approach to problem solving. And its promise is that will allow you to have innovative breakthroughs. So the kind of basic belief behind design thinking is that this believing that the belief is that if you think like a designer and you behave like a designer, you can transform a particular product, service, but also process as well as organization. And there is a principle that really runs through design thinking. And the principle behind that is that human needs determine design choices. Just to show you what that actually looks like in process. So this is if you were kind of looking at the design thinking methodology and those different stages. Starts in empathy, moves through to define, ideate, prototype, test. I'm not going to kind of detail each of those stages, but just to give you an overview of what those different sets look like. So kind of critique one for me is design thinking talks about this mythical user, and where the most important human is me. And when I say is me, is the end user that you are designing for. Now, I think this is problematic because we do not ever operate as human beings in isolation. We are social beings by our very nature. Society doesn't operate in these kind of silos. Everything is connected. And, you know, when we talk about designing products and services, we need to remember that a product and a system or an app, whatever it is that we're designing, it's never just an app. It's never just a service. When we're designing these things, they are interlocking with other social systems that they engage with. And so when we're thinking about designing for a person, we need to think about who is this person? What kind of social system, social service are they engaged in? And then how does this kind of engage with other kinds of social services? So the kind of real premise here, the critique around this is that actually by thinking about individual users, you are doing a disservice to your product and to your service, and that you actually need to think much broader when you are using the design thinking methodology. So what does this look like, and how have we kind of overcome this challenge on the service that I'm working on, or the project I'm working on? Well, we've kind of put this new lens on things. So we talk about designing for relationships and not just our users. The other thing that we did is very early on is we looked at our service. So we looked at lasting powers of attorney. And we kind of created this a bit of a system and social map to look at all of the different social systems that modernizing lasting powers of attorney kind of interacts with. So it interacts with the financial service, interacts with health and care systems, legal systems. And we made sure that when we were designing our research methodology, that we made sure that we kind of brought in people and representative groups from these different services. But mostly we did this by not just talking to them individually, but we actually tried to create a very collective research methodology by running diary studies, by running focus groups, by hosting many co-creation workshops. We did do some individual one-on-one usability testing, but we've also had huge success where we've actually tested in pairs. So we've tested with a mother and a daughter, or a husband and a wife, or two partners. And so that kind of collective approach to design thinking has allowed us to really think about this individual person, this individual user, and how do they socially engage with all of the different kind of groups that are taking place around them and all the different social services and social systems taking place around them. My second critique around design thinking is that it is presented as a straight line. Now, when you are very new to design thinking, you have a desire and a tendency, and let me bring up the previous slide that I had here. You have a desire and a tendency to want to move and from empathy straight into divine, then you want to move straight into ideate. And you want to be quite strict and modular with yourself when you first start this process. But actually, what you start to realize is that iteration is your best friend. And don't try and just stay within this very straight line linear approach. Really, design thinking is not this like very perfect straight line journey that you're going to go through. You have to lean into the messiness of it. And so actually, instead of it being step 1, step 2, step 3, step 4, etc., it actually looks a lot more like this when you start to do it. And you have to sometimes lean into the discomfort of this, right? Because when you look at this, you think, this is really messy. I just want to put empathy in the defined sections and behind me, and I want to move into ideate. But you start to see that ideate and prototyping and testing drags you all the way back into empathy and define, so that you can further kind of connect with the people that you are designing with, further define the challenge, further come up with better ideas. And so this is kind of a big thing that I talk a lot about when I'm teaching design thinking as a methodology to my students, is to get them into this mindset around this iterative approach and drag them away from this desire to want to go into one section and complete it perfectly before moving to another section. The very last thing that I wanted to talk about in my time this morning is talking about is it feasible? So within the design thinking methodology, they talk a lot about like coming up with solutions that are feasible for an organization. Now, when they talk about feasibility, most of the literature and most of the work done in this space is around, is it financially feasible? Can our organization take the financial hits of coming up with a solution or implementing the solution? Is it operationally feasible? You know, can we do this as an organization? Do we have the right kind of processes, teams, etc.? And then there's a question around desirability. Do our clients, do the people, our customers, do they want this solution from us? However, we need to think about ethical feasibility too. And this is another kind of critique that I would add to the design thinking method. We need to think about, you know, just because we can do something doesn't mean we should do something. So, you know, when you think about ethics, we need to think about, you know, what are kind of conditions are we trying to promote to allow human flourishing to occur? Is our solution respectful of the dignity of others? Will the solution, this new innovation that we're coming up, allow somebody to live a life of integrity and principle? And so adding that sort of like ethical lens really changes the way that you design your solution and also the way you implement it. So how have we done this within our project? So first of all, we wrote some digital identity principles that was a combined effort with a team and something that I helped to lead on. This really became the benchmark of when we were coming and dealing with a particularly tricky part of our solution, which is a digital identity component, to make sure that we were designing something that was really inclusive and accounted for a wide number of needs. We did a lot of work around equality and impact analysis and making sure that our designs were informed by that work. We've also partnered with a specialized research organization called the RIDC to support research into accessibility needs for those individuals living with disabilities. At one stage in our project, we didn't have enough time to reflect on the work that we were doing and conducting within research. So we switched our sprints from 2 weeks to 3 weeks to give us some more time. We work within a very multidisciplinary team, and this is something that is really required if you are working in a design thinking way, and also if you are wanting to implement ethics within your team. You need a wide range of viewpoints and perspective taking in order to make sure that you are not just designing within a silo, within the kind of boundaries that the team have lived in. And then lastly, ethics in action is also about thinking around the environment as a stakeholder. Within government, we of course have to meet some particular goals and standards. And so we have to really make sure that we have met those standards within our own service. So just a very quick summary on the work that I just spoke about. Think about designing for relationships and social systems, not just users. Resist the straight line. Remember, you have to kind of lean into the messiness of design thinking, and the iteration is your really good friend. And just because you can do something doesn't mean that you should. So considering ethical feasibility alongside those other kinds of feasibility. Thank you so much.
Thank you so much, Lisa. This is really, really exciting. And these challenges seem too familiar actually to us. So I was really also curious to hear more about like the cycle approach, and then like really going back and forth is an integral part of the process. So maybe one follow-up question, and also encourage them to send our like questions through the chat, and we will definitely like or pick up these questions in the discussion later. So can you maybe just elaborate quickly like on these identity principles? Like how many did you come up with, and like what were they looking or like
Yeah, absolutely. So digital identity is a really massive topic it's an innovation that's really taking the world by storm. And there's a lot of work that is currently happening within the UK government around digital identity. And this work will become part of national infrastructure. Now, digital identity is how does the government know that you are you when you are applying for a service, a government service? So there are different ways that we need to consider how we identify someone. Now, within the UK, we do not have any identity cards, or so we need to use other types of documents. So this could include driving license, or it could include, say, for instance, a passport. But we know that very many people don't have driving licenses and passports. So our digital identity principles really wanted to look at inclusive identity. What are some of the things that we need to really consider to be able to build an inclusive digital identity system? We also did a lot of work in our principles around privacy and people maintaining access to their own data, so that that data wasn't just stored in massive silos and became a risk to that person. So there were a lot of things around empowerment, privacy, inclusivity, making sure that the system itself and the component itself that we designed became a service that we could allow people to access both online as well as offline. Because one of the things that we've came across very quickly in our work is that people might have the right documents, but they may not wish to use those documents in a digital channel. They may feel much more safe and much more secure to be able to do that in an offline way using paper channels. So that was a kind of another thing we needed to think about, was this inclusivity of channels that we offered.
Thank you so much. So I hope there are lots of questions that we can like also pick up on during the discussion later. So maybe let's continue to Alfonso. Lisa, would you mind giving or handing over the host to Alfonso?
Yes, no problems.
Hello, good morning, everybody. I think you can see my screen now, can you?
Yeah, we can. Thanks.
I'm gonna try to see if I can put it full screen and it doesn't go nuts. So let's see whether it works. Is it okay?
Yeah, that looks perfect.
Lovely, great. Well, thank you very much for the invitation, Alessandro. Thanks a lot, Lisa, for this initial intro. And yes, my name is Alfonso. I'm the Chief Executive Officer of the European Social Network. And as Alessandro was saying, the European Social Network, or ESN, is a network of public administrations in the field of social services. And we work with our members, currently more than 160 member organizations in 35 countries, to promote exchange of knowledge, to build up knowledge, to build up capacity, promote peer support. On the one hand, to improve public social services, and on the other, to promote effective public policies in the field of social inclusion, with a focus, as you can imagine, this exchange of knowledge is promoting new, also innovative ways of working, and in itself, the network and some of the activities that we do, such as the European Awards that we launched in the year 2018, are an innovation in itself. Now, so this is what we do, and just a couple of words also. Myself, I am a sociologist. I've been working in ESN already for almost 13 years now. I had worked before in the UK for a couple of years in a couple of charities in relation to how to evaluate policies and some of the services in the field of children and young people. In addition to working at ESN, I also teach on social innovation and integrated social services in a number of places, mostly in Spain. And I've also done a number of trainings for civil servants, particularly from the Balkans and Turkey. Now, what we do, as I said, what we do within ESN is to try to facilitate exchange and implementation of best practice, bringing policymakers in the public sector, as well as researchers and practitioners and people using services together. And precisely what we want to talk about today is design thinking applied to the field of social services. So what I'm going to try to do is to take you through the concept of co-production, which was also mentioned earlier on, and how co-production can be implemented in the field of social services, some innovations depending on the country or depending on the perspective you look at from, and also how we can, what is the escape right now, and how we can move things forward in the future. So these are some examples of some of our work in this area. For instance, the publication Investing in Later Life looked at a number of things, amongst them how the participation of older people using services has been changing over the years. And also there we've got some examples, for instance, of how daycare centers have transformed themselves into active participation centers, for example, in a number of European countries. Integrated support, integrated care and support, actually the focus there was to look at how integrated care and support can be promoted across the whole life cycle. And within this, we have some examples of how people using services are involved, for instance, in the design, in the delivery, and also the evaluation of preventative services. And in the year 2019, we organized a forum of co-production, and there we looked at different examples of how we understand co-production, what are the different levels of co-production, and how this can be meaningfully implemented in an area like social services, where it's not easy, as you've got loads of regulations, loads of safeguarding in place. You're working with very vulnerable and frail people in many respects, and therefore you have to have loads of safeguarding in places. So the co-production forum helped us to understand a little bit better what was the picture, and actually I'm going to be using a lot of the material from that forum in this short presentation. So what for? would we use co-production in the field of social services? Well, first of all, because people who use services can feel and are listened to, because they can be supported to be able to express their views, and because they can be involved in decision-making processes which actually affect their lives. As a result, people's views are taken into account, and people share power, but also, and very importantly, they share the responsibility for decision-making in areas, as I said earlier on, that affects their lives. How can this be done? Well, this is done in a number of ways. Social services are involving both organizations which represent people, but also people who use services, but also individual experts by experience. And this can be driven by a number of reasons. One of them can be legislation. There are countries where, for instance, people who have experience of poverty are part of the panels which help in the design of policy, but also because it's just simply better for care. So we have examples in which, and I'm going to refer to those, in which people participate in the creation of their own care packages, for instance. And this is because the voice and the goals of people themselves are central in individual casework. As I mentioned earlier on, the concept of co-production and the participation of individuals can happen across the whole service cycle, whether we are looking at planning, delivery, and or evaluation. So these are examples of how people might be involved might be asked to contribute. This is specific to older people in the area of integrated care. I just want to say that I think that there is someone who has the microphone on. I'm going to ask if you've got the microphone on to please switch it off, because otherwise I can hear something in the background. And this is making it very difficult to do the presentation. So if I can please ask to please so that we can switch off the microphone while I'm presenting, so that is easy to continue with the presentation. So as I was saying, there are a number of areas in which we can look at in terms of participation of people using services. We can go from simply providing information all the way down to actual co-production, and within this, you've got a number of possibilities. When we look at the graph that you can see, almost more than 85% of participation of people using services is around the provision of information, but this is not co-production. Even consultation is not co-production itself. Within the intermediary levels, you can have different forms of engagement. Some of them might involve even commissioning services together, what is written there called commissioning, and or evaluating services, and I'm going to give an example of this. Which is after the services have actually been implemented. So as you can see, there is an array of possibilities when it comes to the participation of people who use services in service design, in service implementation, and evaluation. So how do social services involve people who use them? Consultations, either with organizations or with individual experts by experience, is usually what shows the highest percentage when we ask our members. This is from a survey implemented just before the pandemic on the occasion of the co-production forum I mentioned earlier on. There is also the question of how people who use services can be involved in the planning and implementation of those services more generally, around the initial planning, the initial stages of the planning process. But then you've also got individual care plans that can be drafted equally by the professional and people using those services. In social services, something very important is the idea of peer mentoring between people who use services, and also the question of personal budgets. Personal budgets can be an area of innovation in the field of promoting the participation of people using services, because they become active participants of their own care. They actually become buyers of their own care. So this can actually lead to innovation across the board. in terms of people themselves, but also in terms of how you make the market more, let's say, more agile, more responsive to the needs of people who use services which are constantly evolving. What are the outcomes that we can see from implementing a co-production approach, we ask our members. And most of them coincide that better relationships between people using services and professionals is probably one of the most important outcomes, but also that people themselves feel more motivated to be able to reach their goals, and therefore there is an improvement in the quality of life for people using services. Down there, we've got the improvement in efficiency. Actually, is some of the, when we talked about integrated care, when we talked about involving users, improving efficiency is one of the areas which is usually highlighted, but this was actually down in the responses. And also we see some improvement in the increase in people using services. This is interesting because it's probably because there is an improvement in the outreach, in reaching out to some of those vulnerable populations who would benefit from those services. So when we look at the population groups, this is actually a point that I'd like to emphasize, and I will refer to at the end of the presentation. We see that there are some cases where, for instance, for people with physical disabilities, where co-production is actually much more implemented than in other cases, for instance, migrants and refugees, or children, was the population group for whom co-production is less implemented. So this is interesting because actually when we talk about co-production in general, or the involvement of people using services in general, we really need to distinguish who we are referring to. There are huge differences even within certain social or health conditions. If we look at disabilities, for example, there is a significant difference between involvement of people with physical versus people with intellectual disabilities. So when we are looking at promoting this type of involvements, we really need to make sure that we have a targeted approach. Some examples, a couple of examples of people's involvement of services covering some of these potential approaches. A people's vote in residential facilities, for instance, in residential facilities for older people, is a way to establish collaborations with managers and with the staff to be able to improve the quality of care of residents, to protect their rights and interests, peer support to promote support between themselves, to organize and run programs within the facility and within the community, and to collect, discuss, and forward the suggestions of the residents. So this would go more in the consultation type of approach. Co-creation would be My Life, My Plan, which is a form which was developed, co-developed by the staff working in the municipality of Randers in Denmark, together with the with people with intellectual disabilities using social services in this Danish city. The idea is that the form, the goals are actually co-created by the professional together, like the professional reference or the case worker or case manager, together with the person or persons who use the services, and to regularly monitor as to whether those goals are being reached regularly. The idea is really to make sure that there is an agreement between the professional and the service user, the person, in setting the goals, the times by which these goals will be achieved, and regularly monitoring together. So again, going back to the initial statements of making sure that there is both sharing power, but also sharing responsibility. And another example, this time on an evaluation. So the Young Care Inspectors Program in Scotland, the Scottish Care Inspectorate, is an initiative that the care inspectors in Scotland runs, with young people aged 18 to 26 who have experience of care. They've experienced care themselves, and they are trained to actually be able to run evaluations together with the service inspectors. This is important because they are experts by experience. They've got experience of care, therefore they can provide very valuable insights based on their own perspective as people with a care experience. But also they promote peer support because they can quickly create connections with children in care to be able to hear their views and make sure that their views are taken into consideration, both in the planning, in the delivery, and the evaluation of those services by the care inspectorate. So moving forward, and this is specific to the area of social services, I think it's very important to balance, on the one hand, professional judgment, and on the other, people's empowerment. Those two concepts are key when it comes to promoting the participation of people who use services in the design, in the delivery, and the evaluation of those services. For this, we have to have the appropriate legislation and policy, the time and resources to be able to do it. Professionals are so taken away by the day-to-day that they just don't have enough time to actually devote to be able to promote meaningful co-production. And it's also important to have the appropriate legislation to be able to do so. It happens in innovation, in social innovation. Without the legislation, without the time, the resources to be able to do so, is very difficult to implement innovation, simply because people are just taken away by the day-to-day, and they are unable to implement those innovations in the right way. Sometimes they are just taken away by the strict procedures and frameworks that they cannot really move innovation forward. Another thing, as I mentioned earlier on, is how to adapt co-production to different populations. It's not the same to co-produce with older people than it is with people with disabilities. Even within disability, it's different intellectual and let's say physical disabilities. And more than anything, specific focus on those most difficult to reach, those less heard, for instance, children and migrants and refugees. So with this, I thank you, and if you have any questions, don't hesitate to ask. Thanks a lot. I'm gonna stop sharing.
Thank you so much, Alfonso. So maybe let's give the host to Isabella now. She will chair basically the discussion, and I'm very excited about having lots of questions. So please feel free to post them in the chat. Just get the conversation going. But yeah, Isabella, your turn. Oh, we can't hear you. No. Maybe. Okay, so you have some technical support. That's great.
Yes.
Yeah, now we can hear you. Okay. Perfect.
Thank you. Thank you so much. Just quick introduction. My name is Isabella Gady. I work as the Chief Experience Officer at Wonderwork, and I have just so many questions that popped up while both of you were talking. So I'm just gonna kick it off, and also picking up a question that was already mentioned in chat, because quite aligns with some of the thoughts I had, and it was around maybe addressing this mostly to Lisa, when we were talking about sort of, leaning into the messiness of the design process, which you sort of have to, because you kind of go back and forth. And I tend to say usually research never ends, you always have to go back. But then, you have to sort of day-to-day reality of meeting a certain project goal, a timeline, a deadline, and so forth. And we had a question around this also in the chat, how do you actually make this happen in an organization? And I think even more complicated if you work in a quite, let's say, hierarchical and bureaucratic structure, which tend to be a bit more rigid than other organizational types. If you could share some of your experience, or maybe even strategies that you have used to implement a design approach in your context.
Yeah, absolutely. So my very first tip or advice is hire very specialized and very talented delivery managers and senior product managers. These people are like absolute heroes in a team. And I think if you have a really good project manager, really good product manager, and a really good delivery manager, they can really kind of take the stress off the design and research team and make sure that all of the deadlines are sort of made clear to the team, that they also have they need to do a lot of the kind of heavy lifting when it comes to some of those senior stakeholders. So making sure that senior stakeholders are very well aware of what the deadlines are and when they need to approve and sign work off, and getting those dates in their diaries. Sometimes it means booking those dates sort of to 8 to 10 weeks ahead of time to get them in the diary to make sure that they're really aware of the urgency around this. So that's kind of the first thing. The second thing is just keeping in mind that design thinking is a research and design methodology, and that it needs a wrapper on team structure and teams' ways of working. So, you know, we use Agile as a kind of process methodology with our team that allows for iteration to occur. So really making sure that you have the right kind of project management style within the team when you're trying to execute design thinking will go a long way to help you kind of lean into that messiness and allow for that iteration to happen. I think setting regular drum beats within your team's diary is another thing to do. So, you know, setting up a structure where you're saying, you know, for the first week in our design sprints, we're going to be testing. Mondays and Tuesdays are always going to be testing days. Wednesdays and Thursdays are always going to be analysis days. You know, we're always going to feed back to the team the following Monday. This is when we're going to do team planning. This is when we're going to do a retro. And I think making sure that you have those consistent drum beats, again, will allow you to deal with the kind of messiness and will allow you to be able to pivot faster because you have that kind of time already allocated within the whole team's diary, and you're not necessarily scrambling around at the last minute to try to find and align diaries to be able to meet with people. So I'll kind of just pause there, and hopefully that gives people some strategies and some advice on how to do this.
Yes, thank you so much. I might also turn it back to Christine, who asked the question, if she has any follow-up questions, or if that gives a bit of an answer.
Thanks so much for answering, Lisa. Yeah, obviously your answer is helping me, yet I'm still thinking about the budget side, you know, when you think in consulting, how you get a client to pay those circles we have to turn. And maybe it comes with numbers. Maybe we can show the more you test with customers or clients, the better the result is. That was my own idea right now. But yeah, I wonder about the budget side of it.
I wish I had a better answer for you. But I think a lot of questions around budgets are having really open conversations almost before you even start a project with a client, and saying to them, you know, this is what we anticipate is what we're going to be planning for, but kind of really opening up and making sure that people are aware that, you know, not everything always goes to plan when you are working in a design thinking in an agile way. However, you know, as a researcher, I'm so very often removed from those budget questions. So I'm probably not the best person to help answer that question. But, you know, from my perspective, it's a paradigm shift, really. And it's about trying to take clients on that journey to get them to understand that paradigm shift. But, you know, much easier said than done, I'm afraid.
Thanks so much for your answer.
Thank you. Maybe that also leads us to a question with Alfonso that I was wondering about while you're presenting, because you shared some of the benefits that you see, that your members have also communicated, of increasing participation. That's often part of a design process. And then at the same time, we do know that participation always comes with certain challenges, because you mentioned some of them, like for some people, it's easier to participate than for others. Certain approaches also make it easier for certain populations to participate than others. And then we all know there's certain populations that are very, very hard to reach, whether it be like through digital technology or just because they don't have any time. So I'm wondering, you know, what you see as like the biggest challenges when it comes to participation, but also can you share some examples how you maybe from one of the projects within your member network that has overcome some of these challenges, be it like the digital divide or involving, I found it always very difficult, for example, to involve mothers because they tend to have no time. Yes, I turn it over to you, Alfonso. And Lisa, please feel free to weigh in at any time.
Yeah, I mean, I think that the idea of participation is obviously we know that there are certain benefits to participation, which mean that public authorities should be, and more generally, all of us should be promoting this more regularly. But the truth is that it's not an easy thing to do. You were talking about budgets, and in a situation in which, I mean, we've seen it in the UK for many years, in which you've got governments constantly asking for results as soon as possible, as close as possible to an initiative being put in place, it really makes it very difficult to actually promote an agile development where actually the idea is that you are able to experiment. First of all, you need to allow for the time to be able to experiment on the one hand, but for the resources as well to make it happen, and to fail sometimes, because actually by failing, you're able to learn. With those learners, then you are able to see as to whether then you can implement something different, and then as you go along, you can improve. The structure on which public budgets work makes it actually very complicated to be able to make it happen. Even when we look at some examples, for instance, at European level, you've got some examples of budgets which have been specifically created at national level as well, but just because we work at European level, to promote social innovation, for example. I mean, when you look at some of the criteria to assess as to whether those social innovations have been successful, I mean, most of it is just looking at very old-fashioned indicators of, you know, where you spend the money and you know, how many people participated in certain events. Or for instance, you even have situations in which when you are looking at the implementation of randomized controlled trials, specific requirements as to what is the number of participants, which maybe don't necessarily match the requirements of that particular project. So I certainly see budgets and you know how strict some of the public policies and frameworks are as something which make it difficult. On the one hand, they could be turned around and make it an incentive, but still, as things stand now, they are quite difficult. The general environment, you know, the requirement to give results as soon as possible, make it also quite complicated for an agile environment in which you actually test and see as to how things go, to prove how you are spending the money. And certainly in the field in which we work, we are looking at working with vulnerable populations for whom it's obviously much more difficult to be able to participate. Therefore, you need to develop a specific focus, specific targeted programs that promote the participation of those populations that are in many respects quite different from the mainstream population, even though you might actually have very similar reasons as to why they might not be able to participate. But in their case, there are also additional vulnerabilities or conditions that might prevent them from participating unless there is specific support put in place.
Thank you, Alfonso. I don't know if Lisa would want to weigh in, but I have yeah.
Well, one of the things that we did when we were looking at some of the work around inclusive digital identity was we were researching this topic like in the middle of the pandemic. So we couldn't engage with people who we needed to engage with because we were all working online, and we were needing to talk to people who were disconnected, who weren't online, right? So it was this like really crazy situation and scenario for us. And one of the things that we did manage to do that was that ended up being really successful was connecting with charities who were working with those people on the ground. And so we couldn't get to those individual people, but we almost worked with charities who were kind of like this amazing fountain of knowledge, where they shared with us some of those experiences of working with individuals who were struggling to connect, what some of their challenges were. And we got a lot of our research and insights in the middle of the pandemic, when we couldn't connect with those people, by working with those intermediaries and those support teams. So kind of my advice to people is, very often if you're looking to try to get to a hard to reach group and you are really struggling to get there, try to look at the intermediaries. Who are the people that they are working with? Who are they? Who's helping them? And sometimes working with those organizations, very often they are charities or community centers, frontline staff. Those can be an amazing research opportunity with for designers and researchers. Just one sort of thing on that, just to kind of, you have to be mindful of very often those people are under huge amounts of pressure. So just be mindful to be respectful of their time, and make sure that, you know, you kind of get the consent, that they have the time and the energy to work with you. Yeah, so that's just one thing to keep in mind.
Thank you, Lisa. And I might just ask a follow-up question there, because I think you're both sociologists, if I sort of got that right in introduction, which is quite interesting. And I definitely have experienced on my own, but also at Wonderwork, you experience like the bringing together of different disciplines when you use a design approach is sort of like, I think one of the biggest challenges is also the field is maturing, because you get to work on different projects that require simply a transdisciplinary approach to them. But how do you do this, right? Like everyone has something else to offer. And I want to ask you both, as you're both sociologists, like what do you see as like maybe one or two things that sociology might really have to offer to really mature the practice of design in our day-to-day work? Whoever wants to go first.
Alfonso, do you want to go first?
Yeah, sure. I can go ahead. I mean, yes, in our field, we've seen that one of the latest trends, this is not the latest anymore, but because it's been around for some years, but the idea of making sure that people cooperate with each other, promoting partnerships, breaking down silos. So all of this, what you were mentioning, now getting different professionals around the same table, working together, and the difficulties that this entails. And we've seen this when we look, for example, at supporting people who are farthest from the labor market. The need that you must have both employment and social services working together. For example, the area of child protection, you have to have the whole community very much involved. Health and social care, we've seen it during the pandemic, in education as well. So you do need to bring professionals around the table. And I would say that one of the key issues is to allow for the time to facilitate for people to come together. Regular joint trainings are very important. We have examples of where, for instance, social workers and educators have come together to have regular joint trainings in which they understand each other better. They can get to know a little bit what are the issues that they are facing with, children who come from different, who face different challenges, but who are in the same schools. And having those professionals coming together, being trained, having the opportunities to get to know each other is a very important process, so that this can be successful when it comes to cooperation across different disciplines, sectors, and professionals.
Thank you, Lisa. Maybe two things that sociology has to offer design.
Yeah. So I mean, this is, of course, a very subjective and very biased response. So I think sociologists are fantastic for the design thinking methodology and for multidisciplinary teams. Is because of that point that I made earlier in my presentation. Is human-centered interaction and HCI, HCD, human-centered design, has really kind of championed this end user. And people don't live like that. We don't live as these like siloed individuals within society. And as sociologists, you are trained to study social groups. You're trained to see social systems, to train to see social groups. You're not trained to just individually pick people out and just create solutions for them. So I think sociologists provide this opportunity to get a systems thinking approach and bake that into design thinking and allow your team to be able to look beyond just the magical end user and actually design for human relationships, design for social systems. So I would say that is the real benefit to that. That's the first thing. The second thing is that sociologists come with a different set of research methodologies. So, there's a lot of surveys that sociologists have done, over time. There's lots of sociologists who are coming out of this new digital humanities space that are trained in digital research methods, where they're looking at, how do we kind of study URL mapping to be able to better understand politics of association? How can we use Google as SEO and keywords to be able to anticipate what people need information on? How can we use machine learning and artificial intelligence to be able to look at social listening and to be able to kind of get information from the internet in real time and to be able to analyze that? So I think this is a unique kind of research methodology that fits and complements a lot of the HCI, HCD methodologies that work, and you can really kind of bring those in if you have sociologists on your team.
Perfect. Thanks so much. Alfonso, do you want to add maybe one or two things that sociology has to offer us designers?
Yeah, I would agree that one of the key things that sociologists can help with, and actually this is the reason why you've got sociologists, for example, working in social services teams, and in a number of legislations across Europe. When you look at the compositions of social services teams, they include sociologists as one of the professionals that are part of them. Is this idea of helping you to look at the community as a whole, so to have a whole picture of not just the individual needs, so similar to what Lisa was saying, not just the individual needs of the person, but also the wider externalities that also have an impact. This idea of the ecosystem, no? So you've got a system, a whole systems approach. Now you look at the person as a whole, you look at what the needs of the person are, but also what are the assets, what are the different possibilities in terms of supports that the person can have within their family, within their relatives, within their community as a whole. So therefore, this idea of having a community system approach, I think, is something that certainly sociology can help with. And another aspect, I'd say, is practice-led research. So, most of what we need to look at, in that sense, social services, social affairs are very different from medicine, because it's not just about providing, let's say, providing a tablet and then you might be able to get on your feet. Actually, you need to have many more things, and therefore they're having research which is practice-led, which is looking at how practices are implemented, what the results are, and then based on the learnings to test and see and change. I think is something also that sociology can bring into the process of design thinking and involving people certainly in the design, delivery, and evaluation of services.
Thank you so much. We are almost at time, but I have so many more questions, so I'm not sure if I can actually do another round. I think one also resource that we just wanted to share is a book that recently came out. It's called Design for Social Innovation, that sort of has conducted a survey of worldwide projects of people working in this space. We had the honor to be part of this book, of this publication, and I was part of the editorial team, but it sort of really tries to share practices, but also tries to assess their different states, assess like how are people trying to measure impact with them, to really, I think, probably for the first time kind of look at the different practices that exist worldwide, but also the challenges that we have, and maybe look into some of the trajectories or propositions in which directions the practice also needs to evolve. But I want to thank you both for joining us. It was tremendously enlightening. There's so much to take away from, and I think with that, I'm probably just going to close since we have only one meeting left. But I do want to ask both of you if you have anything else to like sort of offer us, because one of my last questions would have been, if I turn it around, what do you think like design has offered like in your work as something new or maybe exciting? Since you have talked a lot about the challenges, but what have you seen as some of the benefits? Maybe one last sentence from the two of you.
I think design thinking as a methodology has been just a fabulous way to take something that feels really complex and help you to work your way through that problem and to come up with not just maybe one solution at the end, but many different ideas on how to tackle that problem. So it's really helped tackle the complexity of really enormous problems. And I think that's what it's brought. Yeah.
Thank you, Lisa. Alfonso, a final sentence, word from you.
Yes, I mean, I think that one of the things that I have seen, if I apply the idea of design thinking into the fields of social services and around the participation, the meaningful participation and engagement of people in services and the whole cycle, I'd say, is that thanks to this, you actually get to understand what are the different perspectives of people who come from different walks of life, who face different vulnerabilities, different situations. They need to be part of it. I mean, you need to ask the professionals need to be part of the whole design process when you're looking at a policy. The end users have to be part of this, because if they are not, then you cannot ensure that your policy is actually going to fulfill the objectives for which the policy or the service was established. And I'd like to say something more in terms of measuring impact when it comes to innovation. I think that one thing is to create the evidence, but also very important is to look at two other aspects, which are those of transferability and sustainability. Making sure that this is sustainable in the long run is absolutely essential. It cannot just be decoupled from generating the evidence in the first place.
Thank you, Alfonso. And with those closing words, I actually promise it's quite sunny. I don't know what happened with my camera, but it's actually quite sunny in Vienna. I'm sending lovely greetings into the world from wherever you joined us. I thank you, everyone, for your time, and for Alessandra and Nick for organizing this, and especially to our two guests. Thank you for taking the time and sharing the insights into your work. And see you at our next lunch.
Thank you so much. Bye-bye.
Thank you.